many people in, apart from all of us. Hello. Hi, Geeta. Hi, Lucy. Okay, we are getting people in. Okay, so let's begin. I think people have started logging in. So, welcome everyone. Good evening, good morning, good afternoon. We have people from across the world right now who have logged in. Welcome to this live webinar series called Share It. This is Ganesh, your host for the evening. I'm also a Global Goodwill Ambassador, humanitarian for Singapore, Malaysia, and India. I've curated this particular series called Share It, and the first chapter is COVID-19 Conundrum, which is beginning now. So while we have faced COVID-19 for almost a year now, time has come to share substantial knowledge with our neighboring countries to eradicate the virus. Through this webinar, we plan to reach out to doctors and frontliners across the globe and create awareness among the citizens and help them in fighting COVID-19. Share It is a knowledge sharing platform where potential networks, Samaritans, experts, countries, and individuals come together with a common goal of empowering the society. So let's welcome our chief guest for the webinar. We have Datuk Marcos Yeo. He's the CEO of Beo Lagoon Malacca and EXCO member of Malaysia Associations of Hotels, Malacca. Again, a beautiful city from Malaysia. We have another member from Malacca. His name is Dennis Sanford. Hi, Dennis. Hi. He's the VP of Tourism Business Club, Malacca, Malaysia. We also have esteemed panelists from India, Dr. Ajay Sankhe. Hi, doctor.
Hello.
Yeah. He's the MBBS, MD, PEDS, Director, Bhaktivedanta Hospital. We have Dr. Shailendra Bajpai from Singapore. Hi, doctor.
Hello, everyone.
Yeah. So he's MBBS, MD Medicine, and he's working for one of the pharma conglomerates called Sanofi. And he's the head of disease management for diabetes and cardiovascular. Then we have Dr. Krishna Prasad. Hi, doctor.
Good morning. Hello, everybody.
Yeah. He's from London. He's FRCP from London and Edinburgh. And he's also a consultant in acute medicine and intensive care physician, University Hospital, AYR, Scotland. And we have two observers. One is from Singapore. He's Santosh Kumar. He's a mentor and a journalist as well. Hi, Santosh.
Hi.
Hi. And we have Murli Raja, advisor for Malacca Consumer and Environment Association, Malaysia. Hi, Murli.
Murli not to be seen.
Murli is, I think that there's a network problem, but we shall continue and he will be joining us soon. I'm thankful to the panelists who have come together for this webinar, and I'm sure it's going to be intriguing. And kindly note, viewers who have logged in, let me see how many of them are there. Oh, it's around 30-40 people in just 2-3 minutes, which is good. So kindly note the webinar content is not intended to be a substitute for professional medical training, advice, diagnosis, or treatment. Always seek the advice of your physicians or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen or heard. Kindly follow the rules and regulations of your government and adhere to WHO guidelines. So let's begin today's session called Share It, and kindly mute your mobile phones. I just did it right now. Okay. So my first question is, we have been battling COVID for almost a year now. How have we managed to contain the spread? So let's begin with Dr. Krishna Prasad.
Good morning, everybody. It's nearly a year. Actually, in the West, we came to know about this illness sort of in late December, January, when we knew we have a new virus coming up. I have to say, we just sort of winged it, as British say. Initially, we had quite a lot of information, which possibly on the hindsight were not right. I'll give you a classic example. As an intensive care physician, we were told not to put anyone on non-invasive ventilator at one point of time, as late as February this year. Now it has become the backbone of survival. So we have learned quite a bit. So the strong points were, now we know what virus causes it. We know majority of the patients are asymptomatic at the time of when they become infectious. By the time they become symptomatic, actually they are on the lag phase of infection. So infection rate comes down. By the time they realize they have an illness, 80% of the patients don't even have any major symptoms other than a bit of cold. We also realize this is one of the illnesses where loss of smell and taste has taken a huge step, unlike the influenza. We also know that majority of the treatments we tried in the beginning have now proven to be not that effective. And we also know that in patients who need to be admitted, most of the patients are those who need oxygen or some kind of ventilator support, and steroids help. So as we stand now, compared, especially from our own perspective, we were having patients left, right, and center in March, April, May, all the way to June. Then we had a big lull, but now we have a second wave going on. I was telling earlier on, we get about 10 patients admitted, though we have a policy, we admit the patients only if they need oxygen or ventilator support. So none of them others we admit. We're getting 10 patients every day in a small hospital like ours. And we are dealing much better nowadays because the mortality rate has come down significantly compared to in the first phase. But the people who get the worst illness are the people who are at the extremes of age, who are overweight, high BMI, patients who are having high blood pressure, and also the patients who have got diabetes. At the moment, the only hope we have is we got 3 major vaccine studies at the moment, and we are hoping that they will be able to roll out next year. But realistically, we don't think it will be much effective this year, probably from next year. It's in the second phase, most of the vaccines. We are waiting for the third phase results as of today. So yes, it's something we have learned every day throughout the journey of this particular illness. And I personally feel we know how to deal with much better now compared to say 6 months back. And quite a lot of things we thought works, doesn't work. Quite a lot of things we thought would not work, does work. So it's a work in progress, I'm afraid. But that's the beauty of science.
Yeah, I completely agree, Doctor. Let's move to Marcosio, Datuk Marcosio. And hi, Marco.
Hi, everyone.
So
Nice to meet
I
you all.
believe Malaysia is in a lot of news. Certainly, politics is the top priority now. But apart from politics, I think it's what matters right now is COVID. So would you like to throw some light on the current situation of Malacca for a fact that once upon a time, Malacca was declared as a green zone, which in itself was an example for other countries. So can you put some light on that, please?
I think the main concern now is just right now the Klang Valley, which consists of Selangor, Putrajaya, and Kuala Lumpur, which are the main cities. Currently, we are having conditional movement control order. So practically, it's another lockdown. So this has a very severe impact on the economics. So I think it does impacts on the Malacca tourism as well, because there's no border, as the border is closed down, so there's no international tourists coming in. So we rely heavily on the local tourism, local tourists to come. And with this lockdown, we see that nobody is coming to Malacca for tourism. It's pretty quiet. And I'm pretty sure that most hotels are facing cancellations. So initially March, we have this MCO. So we thought in July, we can see some improvement with the locals actually traveling after the months of lockdown. So we see some light in July and August. But with this current 2 weeks lockdown, it does impact very severely on the, I don't major on the tourism in Malacca, as well as the retails, F&Bs and whatnot. So we hope that we can see some incentive from the local governments to help the SMEs on this matter.
Okay.
Right.
Okay. Thank you. Thank you. Dr. Shailendra, if you can give us a brief about how Singapore is coping up and your take on this whole COVID conundrum.
Thank you very much, Ganesh. First of all, a big thank you to you and to all the esteemed panelists for the opportunity to contribute, listen, and cross-learning primarily for me. So as just a small disclaimer here, so I'm not representing my company or any organization I work for, as Ganesh said. So I'm with you here as I would say, for an awareness from what is there in the public domain, as well as from my healthcare friends, colleagues, and what's happening around. So the first case in Singapore, as we all know now, was in end of January, actually. And what has helped Singapore to cope up, or I would say to take a charge of the situation, was very unique. If you see the journey in the last 10 months, what has worked in Singapore, and I believe it is based on some of the learnings and the preparedness which happened for the previous epidemics and the pandemics for similar viruses. But the Singapore goes a long way ahead, and I think this is one of the best practices which has to be cultivated over ages. And that is about leadership, it's about governance, and it is about social capital. I think the decision making was pretty fast here. The governance system process were in place, but the implementation, the execution, and respecting what is being put in place was of the highest quality and standard. And then last but not the least, I think the contribution bottoms up of everyone here in the community is commendable. So the social capital which has been cultivated by people are generally abiding, they are law respecting, they know that this is in short, mid and long term, it's in their benefit. So that has gone a very long way in that. So the cases started pretty early, Singapore being a big aviation hub, and there's a lot of traffic, as we know, one of the busiest airport as well. And it's also a business hub for several of the across industry sectors, different sectors and businesses. Many of them having their regional and quite a few global offices in over and above their local offices. And what it meant was that there is a high possibility of contamination, infection, and transmission in the community. I'm not going into the details of the factors about the infection. Dr. Krishna has beautifully given a quick overview of what happened. But the implementation of these processes by awareness and putting measures in place regarding an early, what other countries are calling lockdown, there was a graded measured response, what is known here as DORSCON. So this is about a disease preparedness where different levels of activities are implemented, what can be done, what cannot be done, and what is the advisory for the public, and what is the impact on the activities. So it consists of 3 pillars. So the DORSCON level was raised to orange, which is still continuing. That happened pretty early. Then we went into a longish, lockdown is not the right word. It was called circuit breaker. What it actually means is that many activities where there was a high possibility of people coming together, they were either put on hold or there were restrictions for fewer number of people in all. And I hate to use the term social distancing because we are all human beings, we are social animals and we can't survive, but probably it's more about safe distancing. I think those measures were put in place. There were riders in place, the Epidemic Disease Act was implemented, and the people who knowingly, unknowingly, some of the people who violated it were actually taken to the right conclusion by some reprimanding by penalties or whatever act demanded. So stay home notices, a guarded approach about closing down schools, opening schools when the circuit breaker finally ended in June. Schools resumed with safe distancing measures. Kids were trained to take temperatures. There were markers in the places, public places. And nowadays, what you see here is that in the last week, 10 days, we have hardly a case in the community, like 1 or 2 cases. So in spite of having a total number of just under 58,000 cases, with due regards to due respect to whom we lost, we only had 28 casualties here. The healthcare infrastructure and the triage about management was also cultivated in a very nice fashion in a pyramid principle. There were designated PHPC, which was primary care public health preparedness clinics, where you can kick off a triage with people with having influenza-like symptoms. Then you can go to community facility or a hospital setting based on what you require. And then there was a step-down approach also. I think a sum total of this has helped Singapore to contain the cases a big way. I'm not going into the details of the economic stimulus and a lot of good work the government here has given for small businesses, for employers, employees, SMEs, entrepreneurs, and all. They have all been supported in these tough times by the leadership and the ministry big time. So we'll continue our discussion, but this is my initial top line take on what has helped Singapore to contain it.
Okay. Thank you, Doctor. Now we have Dr. Ajay Sanke, who's from India, and he's director of Bhaktivedanta Hospital. Doctor, if you look at it, Singapore just has two cases. So we received a message sometime back saying we have just two cases, and exactly opposite is India, where it's a fight between India and US to be on the top. But just 2 days back, we heard that the cases have gone down as far as India is concerned. So can you put some light on what are the dynamics which needs to be adopted from other countries which would be beneficial for the citizens of India? Dr.
So yeah, thank you, Ganesh. In India, we have, because of the huge population and the thickness of population at various places, like places like Mumbai, which was like an epicenter, a huge number of cases in the Mumbai region. And that contributed practically for the most of the cases in India to begin with. And now all the major metropolis, they have gone in that acute phase. And overall in India, after the 20th of September, say last week of September, we are now seeing a decline in the number of cases. More cases are now recovering than the active cases. This is the scenario in India, and it is constantly going down as an overall impact in India. Now the second challenge which is going to come is that so far Corona was restricted to urban population, and now it has moved to the rural population. And in rural India, the healthcare infrastructure is not so well organized. And therefore, there is going to be a challenge how to deal with these things. There is definitely advantage though that the rural population is scattered. It is not as thickly populated as in cities, and therefore this spread is likely to be slow. But whatever the spread is, the education level, the preparedness level for the healthcare infrastructure, all these is very, you can say, at a basic minimum level or primary level of healthcare. So that is going to be a challenge. And if the urban population and the rural population, they are connected very well through the systems like EMS and also the online training for the grassroots level workers at the village level, I think that will be the main headway for India's preparedness for COVID in the current scenario. But as overall, we are coming down. We are doing well right now, except that one of our states, the southernmost state, Kerala, which had seen a good decline, has started picking up again. So sort of a second wave is coming in Kerala. But overall in India, the peak is going down. We are flattening the curve and we are going down now. That's the state of affairs in India right now.
Okay. So I think we have a long way to go and there are a lot of challenges. Let's move to a discussion where we are talking about infrastructure and tourism. And certainly vaccination also plays an important role in this whole gamut of activities. Dennis, what's your thought on this particular aspect where you want tourism to flourish, but there are many challenges. So what's your take on it, Dennis?
I believe basically for Malaysia, can you guys hear me?
No, I can't. Yeah.
Could you now?
Yeah, now it's better.
Okay, cool. Malaysia basically is domestic market at the moment, like what Dr. Marco says. But we have to discipline ourselves in wearing face masks, social distancing, and all. But now the numbers is getting high. Today I have a report of 871 cases. So it's getting higher, higher and higher each day. So it's basically self-discipline to our fellow members of Malaysians. Yeah, putting a mask on and social distancing and all. Tourism wise, it's getting very bad basically in Malacca. Um, Last couple of weeks, it's chock a block down the road. Hotels are getting 100% occupancy, but today I get the reports like 10 to 15% or probably 20%. I think Dr. Marco will agree with me also. So it's really bad in tourism wise in Malacca State as for now. So we have to move on. We have to move on. Medical tourism was the uh, place for Malacca, for Indonesia to Malacca. Even that also has been locked down.
Oh,
So
that's,
I will rest my case there.
yeah. So Datuk Marco, would you like to add to what Dennis is saying? Because certainly healthcare tourism has been spoken about for over a period of time, and there are many countries who are looking at Malaysia, Malacca to partner with. So what's your take on it, Marco?
Because like I mentioned, the international border has closed. So many of the those that want to come in from like Indonesia or whatnot from a neighboring country to seek for our medical infrastructure service, that's definitely not as good as last time because the borders are closed. So we definitely lose a very big segment from the international side. So what we can do now is we were hoping to rely on the locals, but with the current CMCO, the conditional moving the conditional MCO now that is implemented in the major city, the Klang Valley, that impacts severely on the Malacca market. As Dennis said, cancellations everywhere for the hotels. The roads are quiet. So I think what we need now is probably some incentive or help from the governments to because there's nothing much we can do. Because borders are just closed. Now the local borders are closed.
Correct. So Datuk Marco, I think the way to move ahead and the answer to all these issues is the vaccine. So let's move to Dr. Shailendra, who can quickly give us a quick update on what's happening in the vaccine world. Dr. Shailendra.
Yes, sure. Thank you, Ganesh. So I think one of the important measures which was flagged pretty early, and all of us understood that we were caught off guard and in our preparedness, and therefore on the management side, apart from we are learning every day the implementation and testing of the existing medications, including repurposing some of the antivirals for similar families of viruses were tried and all. But what came out very prominently that if we don't have a vaccine, then it might become very difficult for us to contain the situation. So a lot of vaccine candidates, some on the existing platforms, some on the new platforms, started pretty early, I would say, in the R&D space. Today, if you look into, we had just under 200 different target compounds in different stages, with almost around 15 human trials and almost 10 or 11 in phase 3, which is like the late phase studies and all. So in the vaccine space, we have to be a bit cautious from several perspectives. One is that, of course, we need a vaccine. How we need it tomorrow. How soon can we get it? That is the big question. So although we are following the regulators, ministry, policymakers, health authorities, they're all following the regular process. But then it has set up a new normal in the development, discovery, development, and approval space. What is happening, which is a very good thing to happen, is that some of the vaccine developments are being accelerated both on the technology, front, but not only on the technology front, but also on the approval side. The regulators have opened up to the idea of looking into the data, however sparse it is in real time, so that they can actually look at it. And of course, with all the riders, checks and balances in place, including the safety review committees and all. And then some of the countries, as we all know, they have given an emergency authorization, which is like a approval for use on basis of limited data, where they have done a risk benefit analysis and found that probably for the vulnerable population, if we allow it, this is likely to provide more benefit than cause the risk. So where are we? I think we are trying to catch up on the bandwagon of creating vaccine for everyone on this planet, because that is the only way to go. How soon it's going to be there? There are, as I said, there are some vaccines which have been recently approved for emergency usage, but for mass availability, mass production, and subsequently distribution in the population, I think we have to be very realistic, and that could actually easily run into end of Q1, Q2, at the earliest next year. And again, I'm only talking of as per the WHO and the information available in public domain. We all know that this would only cater to a specific set of population, the population which is frontline workers, healthcare workers, the vulnerable population, the aged, elderly, and the people who are involved into emergency services and social care. And then eventually it might spill over to mid of 22 or even end of 22, where we can actually have the vaccination for everyone. What is also happening is that this has given us an opportunity for different public health players to come together, set up public-private partnerships. The funding has come from different ministries, but also alliances like Gavi Alliance has come. They have created a COVAX pillar for a fair, equitable distribution and access, so that no country is left behind, and the countries who need it the most also get a fair share. And I'm very happy that today we have more than 170 countries, including some of the big names, into this COVAX pillar of the alliance. What is more challenging is actually not ramping up the production, but also after testing and approval, how many dosage would be given, how long the immunity will last for it, will it become a seasonal thing? We will have to do it like influenza vaccine every 1 year, 2 year, or if there are going to be mutations, but then scaling it up, logistics management, inventory management, supply chain, distribution, storage, and then making it available, making it administrable at the point of care to patients is another, pardon my using the word, it's a nightmarish for the policymakers, because some countries, and I'm very happy that in India, there is already a very nice existing backbone of universal immunization program, with even the cold bags at the last mile in the villages and all. So some countries have limited infrastructure. Some countries are ramping up. There are situations like logistics, inventory management. So the governments and other industry people are partnering. Big pharma has come together. A classical example of two big pharma like Sanofi and GSK coming together, joining hands, bringing capabilities and capacities together with different compounds. So there is a lot happening in this space. This is very good news. There are a lot of learnings, and I hope this will remain in the public health space. We all learn from this, and we should also contribute and think about, and in our space, that how we can make access the biggest challenge, and how can we simplify it at our level, whatever we can contribute in the forums, in the places, in the committees we are sitting in.
So Dr. Krishna, can you like to add to the information that Dr. Shailendra shared with us? Because I believe you have a huge number of patients, and there might be a success story coming from your country.
And fully with regards to prevention, this success story is team which we picked up from Asia, which is using the mask. Because especially in West, there was quite a lot of diffidence about using a mask. Everyone was saying, no, I'm not going to wear a mask. You won't believe it took up to May, June this year when people started accepting a mask. So the most effective at the moment remains the mask, sanitizers, and keeping social distance. But problem is, as quite a lot of people will say, the economy has to open up, the education system has to open up. You can't lock yourself a country. So ultimately, it's a combination of getting the right things, which is the vaccine at some point, which is not going to happen for next year or so, as rightly mentioned, because before a vaccine is deemed as safe, it has to go through various phases. We are taking some bit of a risk trying to get it out as early as possible, but it won't be a risk-free. Second thing, as again Dr. Bajpai said, we don't know how long it's going to last because the one Chinese one, which has just been released, which is called BB1-CoV, they have said that unless you get 2 vaccines, and one on day 1 and one on day 28, it doesn't have a booster effect. So technically, we are going to look at vaccines which might need a booster vaccines. We don't know how long it will last. Influenza, we know, lasts for a year only. So every year we take influenza vaccines. So this point of time, it's actually the most important thing is we might have to reopen the economy. It's the hard reality of life. We have to reopen. Now, we were in complete lockdown. Now, bar the cinemas, all the places are open in Britain. Everyone is complying with masks. But the moment you get into a train, it's a total different story altogether. And naturally, when the universities opened up, just in end of September, we had the second wave in Britain. So it is very difficult. We are all, at the end of the day, social animals, and it's very difficult to actually contain. But mantra is same. You have to wear masks, keep safe distances, and very, very, very importantly, we have to report because Dr. Sankhe was saying about Kerala. It's a very interesting study because for the first 2-3 months, we were thinking they were doing brilliantly, but we knew at some point their test rates are very low. And once the recent festival of Onam and everything came, when they ramped up the test, it has gone into a massive upscale, which was not. So again, it shows the social distancing is an important concept, wearing the mask all the time and telling the people you can speak through a mask, because I see most of the time people wearing a mask and the moment they have to speak, pull it down. It defeats the whole purpose. So there is quite a lot of learning, including us doctors. We learn, our health professionals learn, every professional learn. So initially, when we were given, I remember one of staffs were saying, especially training staff, they can't breathe through the old FFP3 mask. We had to tell them, no, you can breathe. Every surgeon has been breathing for years. So we are all learning through it. But at the moment, we need to open up. Yes, there'll be like a couple of things. Like I come from a small country like Scotland. Scotland, what we did was our economy was ravaged because it's totally dependent on 2 things. One is export, which is essentially our brilliant water whiskey. And the second one is tourism. And there was no tourists coming. But what they started doing is they started promoting local tourism. So the ads are going out in England, Wales, and Scotland, drive. So even we started going around for holidays on the weekends in Scotland rather than flying out to Europe. And I think that is where we have to think about a bit. Local tourism has to be promoted. We have to support the local businesses. And very, very importantly, we have to go to education. Now, as you all know, if someone had said Zoom will be a model of teaching of Microsoft Teams last year, you'd have laughed your guts off. Now we all know all the universities are open because of IT. And that is a fantastic thing. And my own daughter is in university and I have asked her, and she's absolutely happy with that, the amount of teaching she gets to her. So we have to the new normal, which is IT dependent, social distancing, using the mask and hoping getting the vaccine soon. But no shortcuts or miracles at the moment, I'm afraid.
Okay. That's really sad, and I hope that soon a miracle happens. Let's move to Dr. Sankhe, who sits in a hospital, and apparently a few months back, Dr. Sankhe along with his team also installed full-fledged ICU unit, record-breaking time. So, Dr. Ajay Sankhe, what do you have to say about vaccination and people not taking masks very seriously?
So as Shailendra and Krishna both have said, see, this vaccine hope that it will come and it will save us is really not an immediate reality. And even when it comes, maybe after 8-9 months or 1 year, because some vaccines are in phase 3 and very likely that they will come, but again, not less than 6 months to 1 year. So even if they come, no one has even thought of its effectivity, because there are several vaccines like the flu vaccine and all. We have seen their efficacies, and there are varying efficacies because the viruses mutate and so many other factors are there. So I would say the mantra for all of us, for all time, in the future also, is these three things: a good mask, hand wash, repeated hand wash, and distancing. I think that is the, and with that, the fear of corona has to go by a good knowledge and good training and good attitudes, because you can't just remain locked. How long the whole world will remain locked? It is impossible. So therefore, I would say that let us not wait for some chamatkar or some kind of miracle that the vaccine will come and cure everything and we'll have no more fear of corona. This scenario is very unlikely even in the future. So therefore, better that we equip ourselves with good attitudes, and the population worldwide should be taught through various social media and various mediums to change their attitude of being sort of careless towards their own health and others' health. Because somebody who's not wearing a mask, it is not that he is risking himself, he is risking others also. So therefore, those three things, I think that's a universal teaching right from beginning of corona epidemic, and it will go on for the next 1 year, 2 year, whatever. And now the further locking down of any country or any region doesn't seem to be practical, because people need to live, people need to earn. So therefore, we need to learn to live in the current scenario of COVID being around us. And even though you might going out for your work, daily routines, whatever you are doing, including entertainment, if there are proper uh, protocols followed everywhere, whether it is a mall or a cinema theater or a restaurant or a hospital or a educational institute, I think that will be sufficient. Because what I will share with all of you, that most of our doctors in Bhaktivedanta Hospital, they have been treating corona. Some of our doctors have been seeing nearly 50 to 100 cases of corona every day. And just these three things they have followed. And even till today, 95% of our people are still negative for corona. So that's a proof that it works. So what better vaccine than that? I think that's the correct vaccine of attitudinal vaccine, I would say, which all of us need to have.
True, true. So, doctor, I believe you also, the hospital also runs few courses and few nursing courses. Would you like to offer those courses to probably other countries like Malacca or London? Or
Yeah, sure. We have now. This is again a boon of corona. You can say that our whole thinking, like we had no more traveling for conferences, no more lunches for conferences, no more cocktail parties for conferences. No, you are just on Zoom. You can see each other, and you are in a relaxed atmosphere. In fact, actually, according to me, this is fantastic. This has brought us together. Now I can speak to Shailendra, who is sitting in Singapore. I can speak to Krishna Prasad, who's in Scotland. And this has really brought us very close. And the cost has gone down. It's just a Zoom call, which is practically free. So I'm saying we have to look at these new normals, and through this, we can connect to now every corner of the world. So we do have courses for the doctors, because our doctors have set up units. In fact, for our local region, we practically set up all the protocols for how to treat, and the protocols have gone through a lot of versions. And today, one of the best protocols we have with us, and excellent results. So training of doctors, training of nurses, training of healthcare assistants, all this is available with our hospital. And definitely, if somebody is willing, we can offer that. Definitely.
so, Datuk Marco, the offer is open, and I hope that you guys would be able to capitalize on this particular aspect and get that infrastructure of sharing knowledge with each other together. What's your take on this, Datuk Marco?
Sorry, the line is breaking. Can you repeat the question?
Yeah. So Dr. Sanke just said that they have few nursing courses and they have the infrastructure to empower the locals to fight COVID. So are you, as a city, willing to take up this infrastructure of knowledge to enhance the fight?
You mean like the Zoom
No, I think they have
infrastructure?
few nursing courses as well. So would you like to take up the existing domain knowledge from India and implement it in Malacca?
Uh,
So basically it's like a win-win situation, right? So every country
mm,
has a unique selling points. So currently
mm,
India has been, a forefront. They have been seeing many cases every day. So there are a
mm,
lot of learnings which can be, shared with other countries. So
mm,
that's what I was mainly talking about, because Malacca is still, like, the cases are still not those many as compared to
mm.
India.
Yeah, yeah. If I'm sure with the share knowledge, it does helps both parties. But I I I can't comment much on that lah. Probably Dennis, would you like to take on this?
Okay, okay. Okay, let's move to the third segment of this, and it's a very important segment, and everyone is talking about mindful living. So, has the gap between doctors and patients reduced? So, what's your take on it? So, I see Dr. Shailendra smiling over there. So, Doctor, would you like to put some light on this?
So thank you, Ganesh. This is very interesting. We are using the term like new normal and other things. I think this has given us a small pause and time to reflect upon how we are working, how everyone around is working. So there are a lot of different learnings. So I can tell you a bit about what we are doing. I'm active in healthcare space, both within the company and also try to contribute in the community. And what we did was we realized that people are finding it very, very difficult to come to terms with suddenly, the lockdowns. Husband, wife, spouses, they are both are working and they are at home with the kids, and their schools are online, and you have pets and you have everyone around, and you don't have two offices at home to work. And so it was very interesting times. That's one. Secondly, you had those 50 or 100 pair of dresses which we haven't worn for 6 months. All right. And then there were a lot of other things. So there were quite a few learnings, like what is the difference between needs and the wants. And then we were using only few things for a few time, but we really wanted to have very heuristic or nimble ways of daily living, including our food habits, including cooking at home, including what we wear, how we dress, how we interact with people in the office, work, and our family and friends distant. So it gave us some time to reflect upon. And personally, what we did was I personally created a mindfulness community, and we were actually doing some kind of workshops and seminars for people to come together couple of times every week, short sessions. I started with some workshops on nurturing resilience, managing uncertainty. Not rocket science, not very heavy spiritual, religious, or intellectual kind of stuff. No, what is happening around in their daily lives? How do you feel now, and how you should feel now? Because you should come to terms with what is happening, because change is the constant, and this is an opportunity for us to learn and grow. On the far side, what has happened is that being mindful, it has given us opportunity to look into different business models. I already gave an example, like big companies, even Sanofi came out, where we came out with a startup company to devise a small test through a mobile phone. So capacities, capabilities coming together, people realize the value of collaboration versus competition. And just now we were talking about Dr. Sankhe being in a position to offer this knowledge and skill workshops for people across, like in Malaysia to start with. So this is the time of collaboration versus competition. We are moving towards a compassion based economy. As long as we are mindful about it, I think this is a long way to go. So what is going to happen is that world is going to be becoming more interdependent. We need to understand this fact. Look at the balances on the vaccine side and station side or something. People are no more working in silos. So on one hand, we are maintaining safe distancing and social distancing, which we have to, but probably we have to come closer in our day-to-day living, look for new business models. And of course, the bottom line remains the same. You have to be very, very mindful that, okay, change is the only constant. We are still alive, we are breathing every mindful moment, and we should be coming together to support each other to live a simpler life tomorrow. That's what I would say, that mindfulness has been very, very helpful in this approach.
Dr. Krishna, what's your take on this? Because I believe you have been interacting with a lot of COVID patients, and to keep your cool all the time, and
Yeah.
challenges, people not wearing masks, you need to be very quiet and keep meditating and talking to yourself, control. So how has it been for you?
It's very interesting perspective because as opposed to say India or Singapore, in West, one of the biggest problems is that majority of the people are living alone. So even the parents, once a kid is 16 or 17, they leave the house. It's not like we have nanny, dandy, everyone around and brothers or kids around. It's a totally different thing. And they took a major hit because I'll give you an example. Since January, we did not have any clinics, and quite a lot of patients used to come to clinics, actually more of a social event. They used to come and speak to people whom they haven't spoken to. Even if they have a health check every 6 months, that was a social outing. And suddenly these people are all logged in. And it took a massive toll, not only on their general health, because they can't go out for walk. And then the problem is, then, as they say, the idle mind is a devil's workshop. They listen to radios, listen to podcasts, listen to information on the TV, and they get. So one of the things we realized is one of the biggest toll which took was people started worrying a lot and getting more isolated a lot. They did not have anyone to speak to. Simple as that. If you tell the generation here that you can go to internet, you won't believe that majority of the people don't even have an internet at home. They don't use internet. They don't go to any web page. It's only the same old television. They don't even have a satellite television. They just go to the BBC One, BBC Two, and a couple of other channels, and that's their bread and butter. So then the information trickles in. They cannot differentiate between what is the fact and what's the fiction. And that is a big problem. Now, as we commonly say, WhatsApp University has made it much worse. One day someone will say, pouring some glucose liquid to your nose will cure it. And next day someone says, putting turmeric will cure it. Third person says, well, have the... And that has been one of the biggest tragedies. Social isolation and unfortunately quite a lot of misinformation, to the extent that even if the right information comes, you don't know which is right. So very interestingly, Royal College of Psychiatrists actually came up with few plans. It's there on the public domain. It's very interesting. They said one of the first thing they said was people should start connecting. Basically, not connecting with doctors. Pick up the phone. Now that we have WhatsApp, you can even have a video call. It's free of cost, and other things like Boteam and all that. So they said that go and connect with your family, connect with the friends. Then they say that be active. But basically, it doesn't mean, okay, you get back to your normal job. Distract you, read a newspaper, walk out, get out of the house. Don't stay in the house. Or even if you want, walk around, have a new plan. And then the thing is, take notice of what others are doing. Sometimes it helps. Like you go to the shop and suddenly you said, oh, others are wearing a mask. It gets into you. I will also wear a mask. Suddenly they say, oh, again, everyone is smiling. Okay, fine, I can smile too. So that has to come. Keep learning. It's a very important thing. We have to learn for something else. I mean, it could be something, let me go and Google it and find it. What's the reality of it? Of course, it gives quite a lot of bad information, but and very importantly, my personal feeling is there has been a significant improvement in humanity after this particular tragedy. People have become a bit more humane. People have become, we have thought of starting to give, because most of the charities have really taken a hit because there are no donors at the moment. Quite a lot of hospices in West are closing because there are no, but suddenly they started putting that on the public domain and social, this thing networks. Our hospice is closing. We need money. And people started giving money. People who don't even know. You have had hundreds of stories, people who can't do. And so I think one of the positives which has come is, as Dr. Sankhe was saying, the world has become closer. We can get, and humanity has become better, and we have to start giving. So this thing is, I always tell my patients, talk, talk, talk. And that's what we have to do. And sometimes it's extremely helpful, ignore few information, because if you feel I'm very uncomfortable, just ignore. We have to learn to ignore and talk and communicate and probably start giving a bit more. And that will be the best way forward. typical intensive care physician's take on it, not a classical mindfulness person. So, okay.
I think Dr. Ajay Sankhe would like to add to this because he has been speaking on this particular topic, and Bhaktivedanta Hospital has been quite active in doing social work. I know few patients have been even treated free of cost, and they're taking good care of the community in and around the hospital. So, Dr. Ajay, would you like to put some light on that?
Yeah, I'll just, I fully agree with whatever both of them have said. And it has really made us doctors also introspect a lot. I'll just share something. When in the beginning, the data started coming in India, the healthcare, particularly the doctors, when we saw that 1/3 of mortality was of the healthcare workers, whatever the mortality was available. So it's so huge. So naturally, there was a lot of scare amongst the doctors. And I remember we took up a stand because our hospital, Bhaktivedanta Hospital, runs on the principles of Gita. Karmanyavadhikaraste ma phaleshu kadacha. That means do not worry about the results, do your duty properly. So we are geared up like that. And so our hospital was continuously open. We never closed down, nothing happened. And one of the doctors, naturally, many of the doctors who were sort of having very old parents living with them. They considered that if they get COVID, then they were not so much worried about themselves. It was more worry about their family members, that in case something happens to them and they connect to their old parents or young children, that will be disastrous. So one young doctor just recently, so she has joined maybe 1 or 2 years back, and she decided to go back to her village. She's from a little distance, far off distance. And she phoned up the parents. And she said, I'm in a dilemma that, I'm supposed to work here and I would like to work, but at the same time, this risk is there. So the father told her, see, I have made you doctor for such kind of situations. You are a doctor. So if you don't deal with this situation now, when will you show that you are a doctor? You are a doctor for only good times. And then the next day she was there and she told us, I'm not going. So what happened? So this is what my father said. So this is the samskara. This is the teaching. And these kind of things. Another thing which practical experience we had is that some of our doctors, they were helping in the setting up of the government hospital, which was lying sort of unutilized. So we were setting it up. But nonetheless, some patients there were no ICUs and all, no high care, but basic care was there, and some patients were admitted. About 17 patients were admitted. And there was a lot of fear, even though some of them were asymptomatic. At that time, anyone who had a positive report, he was admitted for isolation. So much fear. And no one was talking. The nurses would come with all that PPE. You can't see their eyes. Nothing is seen. Just tablets are dropped there, and you are supposed to take it. And then one of our doctors went in. We are very grateful to him because he actually started that whole thing. And he spent 3 hours just talking to them, first day. And then the nurses and the other healthcare assistants, all of them, they saw that it is possible to talk to them. It is possible to communicate. And they saw on the faces of the patients that they had this new hope because of this doctor. And then he sort of became the lead person for the whole change of attitude in the whole healthcare sector in that hospital. And all the people, whether they were nurses or any other doctors, they were following his example. So I would say these are the things which are, at such times, these attributes of leading by example, leading by the humane ways, they are more important. There is so much fear factor. And one of the things is also notable that the mortality comes down if the fear factor and communication is handled well. This is what we have seen in our own hospital, that we appointed one special doctor just to communicate throughout the day and night. He's just communicating with the patients and their relatives, what's happening, and all queries, whatever fear factors, address them and spend time with them. So this is what one of the things which we did, and that has definitely shown a lot of good results. One more thing which we did is we did not overlook the ability of other pathies to help our patients. So, for example, we took help of Ayurveda, shown good, very good. We are coming out with some research. Already papers are being submitted right now in good journals. Then we took help of homeopathy. We took help of spiritual care. All these things are sort of adjuvants to the main therapy, which was according to the national protocols. And these things have definitely helped us. So this is how I would say, in the current scenario, a new kind of thought process has come in. The doctors also have, as Dr. Krishna Prasad very well said, that doctors have also gone deeper within themselves, and they have understood that they are not gods. They are and they are simply instruments of God. Because in good times you are a big boss, and you have so much authority on the patient. But here we were helpless. We were learning. We are still learning, and we are going through that learning curve. And more or less after all these 8-9 months of Corona, now we know what works, what doesn't work, what something may not work in US. It is working. Like for example, we are still using hydroxychloroquine. And many people say don't use hydro, but we are seeing it is giving results. We are got good results with remdesivir. One good thing is now, last almost a month, we have not used hardly any tocilizumab, because we have not allowed our patients to become critical. So early detection. So all these things are very much, a lot of learnings are happening, and definitely that human race has that resilience of dealing with any kind of crises which come in their life. So this is one of the crises, which is global crisis. And here, as our Prime Minister said, Atmanirbhar Bharat. So it's like Atmanirbhar every place. Every place has to figure out how they can deal with the situation in the local, while taking help of knowledge sharing, which is available globally. So this is how I would look at the mindfulness at this particular time in our context.
Thank you, Dr. Sankey. Now we have Santosh, who's listening to the whole conversation. Your notes on learnings from this webinar, Santosh.
I've been having some internet connection problems. Hopefully you can hear me, I suppose.
Yes, we can.
Yeah. I mean, from what I've seen is that discipline is very key to fight this disease. And that is, I was talking to the Karnataka Health Minister about 2 weeks ago, and he was telling me that nobody in Bangalore and in Karnataka just listen. People are walking around without masks and just going out everywhere, attending events and parties. And he said, this is not the way to control the spread of COVID. So I think that's the main problem with India, I think. Though the numbers are coming down, there are certain states like Kerala, for example. In the initial stages, I did a story on the health minister there and how they were fighting the COVID and doing a good job. And just last week, I had to do another story saying everything is just going downhill. And the thing is, they're not being able to control, and the people are not disciplined. And the situation with Singapore basically being able to fight and overcome this pandemic is that people do listen. Though there are strict measures, there are fines imposed, but people do listen to what the government is saying, and they take it as their responsibility that they should be careful and be safe and see that this doesn't spread. So overall, I think the doctors have given a good perspective of what's happening in Singapore, India, and Scotland. And I think it's all of us have to join together to fight this pandemic.
Okay.
So that's the way to go.
Thanks, Santosh. Murli, can we have your take on the discussion, please? Murli, are you there? Murli, are you there? Okay, let's move to.
Ganesh,
Yes,
Ganesh,
yes, Ganesh. I'm
Yes.
here around.
Okay, we just need
Sorry,
your.
I have lost the video.
Okay.
And what is what we'll do is I felt today's discussion is very what it is very worthy,
Okay.
and at least we had some tips to be shared. So to the what is Dato Marco and Dennis, who represent the tourism industry in Malacca. So I guess that is quite what it is the tips and like the nursing home that was offered.
Yes.
And we can look into exploring the the opportunities.
True.
So that will be very great, for Malacca to I mean start training and the frontliners, especially the hoteliers.
Yeah.
The hoteliers which need this kind of crucial elements to control the spread of the pandemic.
True. True, Murli.
So thanks for having this, and on behalf of Malacca, especially Dr. Marco and Dennis, thank very much. Thank you guys for having this kind of forum, which is has really helped in the sense of spreading the tips and all.
Okay.
Thank you very much.
Thank you, Murli. So I think you are done for this time, and hopefully we meet again. Probably, Marco, Datuk Marco, would you like to share something for your citizens to listen to listen to some of the doctors who are here? I think your citizens.
Okay. Yeah. So this pandemic is here, and what we can do is we have to stand united together. Practice the SOP, wear mask, sanitize your hand, keep washing your hand. Hygiene is important, and the physical distancing. I believe with that, with the determination, I believe we can fight this together and move forward. Let's just keep a positivity mind. I think it's important for us to keep positive mind and move forward.
True.
Thank you.
Thank you. Dennis, your closing notes, please.
I suggest the same thing as Dr. Marco. We want to stay safe. Just stay safe.
Okay.
And what Murli said earlier, we have to work together. I think medical tourism will be a very good boost. And after the COVID dissolve, Malacca, especially Malacca itself, we have a lot of medical tourism coming in town from Indonesia, from Singapore, and also. So we need you guys to help us.
Okay. Thank you, Dennis. We have a few questions, but I'll just take one because I think we have exceeded our time. The question is from Dr. Kailash Methe, and he says the indirect impact of lockdown and on environment was positive. What is the take from the forum? So probably we'll have quick wins from Dr. Krishna, Dr. Sankhe, and Dr. Sharendra. So begin with Dr. Krishna on this particular one, if you can.
Yeah, the environmental pollution went down, it's true, but that we have to accept that some amount of pollution is part and parcel of economy. So we can't close it down entirely. I'm not saying that I'm negating the environmental effect of pollution. I'm still believe in green, but I think it's possibly a negative gain of unfortunately a pretty negative illness. I don't think we should be correlating environmental protection with the COVID. We should be looking at the technologies to reduce the pollution, even with the COVID on or COVID out. I think both are totally unrelated. Yes, it's nice to see some of the minerals from a decade, I mean, eons away, but still, I think it's a good thing, but it's not the way to achieve by causing a long term. Yeah.
Dr. Sanke, please.
Yeah, one of my friends, he was 85 kilos and he suffered a stroke. And then he was a jolly person. So when he was recovering, by the time he recovered, he was 64. So he said, yeah, but I don't recommend this as a weight reduction program. So something similar. But nonetheless, the environment effect is tremendous. Definitely, one of our cities in India, Ghaziabad, one of the most polluted cities. There, within 3 months of lockdown, the Ankleshwar Environmental Studies University, they studied it. Within 3 months of lockdown, the pollution levels had come down by 85%. And not only that, all of us can perceive it, that when we see outside, the air quality is much better, the flora and fauna is much better. So overall, I would say the environment has definitely, the water in the rivers like Ganga, Yamuna, it's never been clean as like this. It is crystal clear water. So it's amazing and it's very heartening actually. In fact, if whatever it means to any one of you, I am saying actually that the overall internationally, globally, we should think that can we have a sort of a reset button every 2 years for 3 months we lock down. Just without affecting the economy in a particular way. It's like we have a concept in India of Chaturmas, that just don't travel, don't do anything, and just introspect, just spend time with your family, with yourself. I think that is internal environment as well as external environment will do much better. There will be a lot of environmental healing. So I would say that we should, wherever we have a circle of influence, we should talk about it that, every 2 years or just for 3 months, plan it in a way that, you just don't get into that routine business of just too much travel or too much doing this or that. Just calm down, be with yourself, be with your family, let the environment regenerate itself. I would say this is my take. I am very serious about it.
Thank you. Shailendra, if you can add your inputs on this one.
Just quick ones. I think Dr. Krishna has made a very good point, and Dr. Sanke has put it very nicely. I totally agree with that. I think it gave us some moments of reflection on, what can happen, what we were missing. So honestly, this is a good opportunity for reflecting upon that. What a change which we didn't want can make a big change in the overall planet, I would say. Let's understand that the planet doesn't need us. We need the planet for sure. The other way around. And there were all of those pictures and everything floating around, the wild animals coming to reclaim their territory in outside our flats, apartments and colonies. So that was very refreshing. I think this has given us some moments to think, not only think, but I think as Dr. Sanke underlined, and I like this very much, that we should use this opportunity and not waste it. We should unlearn what we have done. We should take it as a part and parcel, and by default, it should become a part of our sensitivity to the environment, and we should implement policies and practices and procedures to inculcate it, beyond the classical CSR and people, planet, and process, which is more like cosmetic than anything else. So I'm for it, and I think, of course, we all need to define ways and means that how we can minimize the impact on economy, but still do it the right way. Yeah.
Okay. So I think that's all for now. We have actually exceeded the time limit. So I would like to thank all the panelists, Dr. Krishna, Ajay Sankheji, Shailendra from Singapore, Santosh Kumar, Murli, and two special guests, Datok Marcosio and Dennis, who've joined us from Malacca. I'm extremely thankful to you for giving your time to the panel. And I hope that we have some great outputs in 2 months down the line, and hope we don't meet again and talk about COVID again ever in our life. So thank you all for your time. Thank you. Thank you.
Bye.
Thank you. Bye.
Thanks.
Bye. Thanks.
Bye.
Bye.
Thank you, guys.
Thank you. Bye.